So you've been diagnosed with an abscess and given an I&D, or an incision and drainage. Here's what you need to know and a bit of what you might like to know. So an abscess happens when there is some kind of entry of bacteria into the skin, and that bacteria then forms a ball of pus underneath the surface of the skin. So that can happen when you have an ingrown hair, when you have an insect bite, if you have a pimple there, or even just a cut, then the bacteria can get in there, and then they form a wall around the ball of pus that antibiotics can't usually penetrate or get into. Now, if it's a very small abscess, or boil is the other word that people often use to describe this, antibiotics may be effective. So your doctor may start with just some antibiotics if it's a small abscess or boil. However, if it's quite big, it's not going to come out or be treated with the antibiotics. That wall protects the ball of pus and the bacteria from the antibiotics. So then you need to open it up, which is what you've had done in the emergency room. And we put a little cut. I want you to pretend this is an arm here. We put a little cut in the skin, and that allows for all that pus to come out, and we usually wash it out in the emergency room. And then we put in some ribbon gauze. This is sort of 1/2-inch gauze that we tuck inside the wound, not too tight, but tight enough so that it keeps it open. And most importantly, it keeps this slit open. Otherwise, your skin is smart, and it will reseal up in a day or two. And then the ball of pus will just reaccumulate, and you've got the same problem as you had before. So you want to keep this in there to keep it open. Now, you may find that it gets completely covered with pus and blood, and that is actually a good thing. You want it to be covered in pus and blood because it means it's draining out all the pus from inside. That's good. Now, if it's before 2 days is up since you were seen, you can just gently pull it out and then put another piece in, and just keep it in a little bit. You don't have to pack it in too tightly, but so that this doesn't reseal up. Otherwise, if you weren't given any instructions and it's not covered in pus or blood, you can leave it for 2 days and then just gently pull it out. You want to keep the area nice and washed, cleaned as best you can. And if it was small, then that's fine. You let it heal from there. If it was quite big, the emergency physician may have arranged for you to see a nurse or to see your family doctor within 2 to 3 days to take that out and then put another layer back inside, so that it can slowly heal from the bottom up. So that cavity will then close up, and then no more pus can accumulate. So that will be in about 2 to 3 days, and sometimes if it was quite big, you do that for several days, get the packing changed. If you were given antibiotics because there was a cellulitis or infection around the area as well, make sure you take the whole prescription, don't stop early, and take it as directed. Reasons to come back to the emergency room include increasing pain or worsening redness. So if there's red that's now getting bigger and bigger around the cut site, or there's a streak of red going up your arm or up your leg, that suggests that the infection is spreading and you need to come back to the emergency room for that. You should be getting better within 2 to 3 days if you're on antibiotics. If you're not on antibiotics, then this should just heal on its own. But if you do develop a new fever, that'd be 38.0 degrees in Celsius or 100.4 in Fahrenheit, you also need to come back to the emergency room. That'd be reason number 3. I'm Dr. Atzema, and those are my discharge instructions for an abscess, incision, and drainage.